For many years, I had different GI issues, but I never really, pay attention to them. But the year before my diagnosis, I started to feel odd.
Nayda was diagnosed with rectal cancer. It was caught with a screening colonoscopy. After that, we found that she was stage 2, which meant she needed surgery. She did get some chemotherapy, but it was only for a short time after.
When someone said you have cancer, it's very difficult to accept in that moment, right? So I said, I'm sure that is wrong, right? I'm sure that that's not the case.
Latinos have a high rate of early onset colorectal cancer. So that's why it's important for Latinos to talk to their doctor about when they should get their first colonoscopy.
The worst part of the colonoscopy is the preparation, but it's nothing compared to actually being through the cancer. For the Latino community, I think it's important for them to understand that they are people that can help you with translation, with insurance, and really go and see their doctors and ask them and advocate for themselves.
I think the barriers to care in the Latino population include education, feeling trust in the medical system, feeling that they can discuss these symptoms openly with their primary care doctor.
That's the culture side of it. We don't talk about those things. I didn't say anything to anyone. Not even my youngest daughter knew about it.
Probably the most important thing I can suggest as a colorectal surgeon who's dedicated their life to helping prevent colon cancer is talk to your doctor about when you should get screened for colon cancer. No matter what, it should be at age 45 and sooner if they have any concerning symptoms or if they have a family history of colon cancer.
Because of my history of cancer, my daughters needed to screen earlier. My oldest one already had her first colonoscopy at 36 years old, and they found 2 polyps and were removed.
Nayda is an ideal patient. She got her screening colonoscopies. If she hadn't, it could have been a higher stage and more difficult to treat. So the fact that it was stage 2 meant that we can treat it with surgery. And then ever since then, she's been free of cancer. We say she's in remission.
Any change that you have in your bowel, it's important for you to talk to your doctors and go through those symptoms with your doctor and advocate to get your colonoscopy done. Even if it is nothing, and hopefully it's nothing, but you need to do that. No one will do it for you. You need to do that. For me, my family, we call Dr. Bello our hero because he is actually our hero.